I'm like, oh, drag her out of the weeds quick.
Those are flowers.
Yeah, flowers. Yeah, they're root flowers. Yeah. But the learn how to add telehealth to your healthcare setting was a very interesting project, and I think we did really well with it. In fact, I think we probably did 3 times better than what I thought would happen. So that's really, and I'm an optimist. But we had 7 education sessions in 5 counties. We had 64 attendees. We had volunteers at each one. In addition, maybe we had a couple volunteers each too. In addition to the attendees, all the counties were represented. We had participants from long-term care, mental health centers, home care, occupational health, Indian health services, hospitals, clinics. We had people that were from the business spectrum of things, as well as clinicians. We had physicians there. We had engineers there, biomedical engineers, administrators, nurses, social workers, many people in the kind of the business planning realm, which was just great. So I think we had a good mix of people. Increased awareness of business and partnering opportunities and how to implement telehealth. I think people just were really thrilled by the program, and I think they were able to what I call connect the dots. And somebody should time me. Kind of weeds. They were able to connect the dots, and part of what we did was we actually had times to collaborate and discuss opportunities right then and there, because in those counties, or very neighboring counties, there were lots of chances for people to be working together. And so people who hadn't really seen how to do it before were kind of putting some things together. I have followed up on several of those, and there are like 3 different places that are working together: Monaga and Northern Pines Mental Health Center, and Lutheran Social Services, and Essentia, and and Indian Health Services. So really great. One of the focuses was on focuses for telehealth. Of course, is stretching scarce providers and the need for easier, closer access for people, especially, traveling in rural areas in particular. And so I was really pleased that we did get some providers that were able to come and were able to kind of maybe sway their thinking just a little bit of, one physician, psychiatrist said to me, this is something that we need to be doing, and, I'm going to take it backward and start doing it. So, that just some really pretty big wins. The biggest challenge was assembling the invitation list and doing personal contacts to sites. The evaluations were all really positive, but I guess if I had to do it again, I would, you kind of go through and, it's a concentrated period of time, but that was such a challenge, that the invitee list, I ended up doing a lot of personal contacts myself, which was fine. I know people, in some of the places. But I was hoping to get like veterinarians, ophthalmologists, optometrists, some of those kinds of places. Public health. We didn't have a very good showing from public health. And I really thought that they would come. And I contacted them all personally too. And no, it's very hard for people to get away in public health too, because they're very short staffed. But I think what I probably would do, if I had to do it over again, I would have asked Blandon for more help on that. And I just was thinking about that just now as you were talking, Bernadine, because, I could have used some power connections, something that says, you send somebody to this. And we had Pam Mailing helping me, and that was very, very good because she has a lot of connections as well. And so anyway, but it was very, very positive. I had a lot of fun doing it. And I think people learned a lot, and so.
Yeah.
Yeah.
That's a celebration.
Yeah.
I'm wondering, do you think